measures about 40 to 50 microns. In comparison, an average red blood cell is 7 microns in diameter. This field is negative for sperm cells. It also shows background debris and epithelial cells, WBC, and bacteria. A positive identification of an oval object as a sperm cell is imperative because motility can be simulated by other factors. Take great care to avoid confusion with Brownian movement of trichomonas, as this also causes apparent motility. After completion of the microscopic examination, the cover slips are left in place and the slides placed into carriers. The carriers are shut and placed in the right envelopes. The history of physical form is then completed, showing the results of the microscopic examination. Sketches of trauma or other physical findings are completed. The envelopes are then initialized and placed in the bottom of the kit. The evidence kit is sealed with a tamper prevention tape contained in the kit and is placed in the bag labeled biohazard. Place the bag in a locked refrigerator or under lock and key in a secure area till the time it is delivered to the police authorities. Once you have examined the patient, therapeutic aspect is important for prevention of pregnancy and STDs, including HIV and hepatitis B.
सविता, मैं तुम्हें एक बात और बताना चाहूंगी। ऐसे हादसे के कारण दो तरह की परेशानी हो सकती है। एक तो प्रेगनेंसी हो सकती है, एक संक्रमित रोग हो सकते हैं। हम इन दोनों के लिए तुम्हें दवा दे सकते हैं। क्या तुम ऐसी दवा लेना चाहोगी?
Yes, ma'am.
ले लोगी दवा? ठीक है।
Data concerning the incidence of STDs following a sexual assault are few. However, it is estimated that gonorrhea is contracted in 1 in 30 cases, chlamydia in 1 in 10, condyloma in 1 in 4, HIV in 1 in 1,000, and syphilis 1 per 1,000. The incidence for transmission of hepatitis B is largely unknown. However, in non-immune or unvaccinated individuals, immune globulins should be considered. Suggested protocol and dosages against these potential infections are shown here. In non-pregnant, non-allergic individuals, one of the most common and accepted regimens for prophylaxis against both gonorrhea and chlamydia is doxycycline, 300 milligrams orally stat, followed by 100 milligrams twice daily for 3 days. Fluoxetine is also an acceptable alternative at a dose of 400 milligrams twice daily. A little tolerated but more expensive alternative is azithromycin in a one-time dose of 2 grams orally. In pregnant and adolescent, erythromycin is an alternative at a dose of 1.5 grams orally stat, followed by 500 milligrams 4 times daily for 7 days. The risk of HIV infection is small. However, should prophylaxis be indicated, the correct regimen usually consists of triple drug therapy with zidovudine, lamivudine, and nevirapine, or stavudine, lamivudine, and nevirapine. This is now available in the country. The incidence of pregnancy in susceptible victims is estimated as nearly 8 for 100. Prophylaxis against pregnancy may be effective up to 72 hours. Using dedicated levonorgestrel emergency contraceptive pill, the pregnancy rate is brought down to 1 per 100. By using conventional oral contraceptive pills, it is brought down to 2 per 100.
ये लो, पर एक बात का ध्यान रखना होगा, ये दोनों दवाइयाँ तुम तभी लोगी जब एक बार तुम्हारी प्रेगनेंसी टेस्ट की रिपोर्ट आ जाएगी। उससे पहले कोई भी दवा तुम्हें नहीं लेनी है, ठीक है?
In order to enhance evidence collection, it may be necessary to employ one or more special forensic techniques. Colposcopy to search for microlacerations, toluidine blue staining to enhance the texture of microtrauma, Wood's lamp examination to enhance the texture of stain or the skin, especially seminal fluid stains, forensic odontology for bite mark casting. Colposcopy is the examination of the lower genital tract using a binocular microscope. By bringing the skin of the vulva under magnification, it is possible to find microlacerations, which will otherwise be undetected. If the victim reports that she has had no sexual activity for several days prior to the assault, and especially if the victim is virginal, microlacerations are a significant finding. Toluidine blue is a stain which assists in identifying small lacerations. The stain is applied with a cotton tip applicator or sprayed on the vulva. The excess is washed away with water. The stain is taken up by the subcutaneous connective tissue exposed if lacerations occur. Thus, these lacerations show up as short lines with staining. A Wood's lamp is a very useful tool in detecting stains, especially semen, which is not easily visible to the naked eye. To use it, darken the room and project the UV-colored light across the skin while looking for areas with shine or fluorescence. The Wood's lamp illuminates the surface beneath the skin. The areas which show white or proluminescence are then sampled with moistened swab for later examination in the laboratory. Additional special techniques include forensic odontology, in which bite marks are photographed and 3D casts are made, which may be matched to the jaw pattern of the assailant. The findings of these special forensic examinations should be recorded on the physician's examination report. Now we move on to the second part of our video, age determination.
Age verification of trafficking and sexual abuse victims is mandatory under Section 15, subsection 15A of the Immoral Trafficking Prevention Act of 1956. Age verification establishes whether the victim is a major or a minor, and this has a critical bearing on the outcome of the case. According to the ITPA, trafficking of minors is a more heinous offense, and it warrants much more stringent punishment. Age determination constitutes of 4 parts: general physical examination, examination of secondary sexual characteristics, dentition, and radiological examination. Conduct a general physical examination and secondary sexual characters examination using the age-related data for height and weight for boys and girls separately, and examine the development of secondary sexual characteristics like hormonal changes, axillary hair, acne, menstruation, breast development, the pubic hair, in line with Tanner's indicators of puberty. Dental X-rays like orthopantogram or an OPG will establish the age fairly accurately between the ages of 6 and 12 years. Similarly, radiological examination of bones will give a fairly accurate age estimate by studying the ossification centers of long bones. A thorough dental and radiological examination can give correct age estimation within ±6 months. The age determination test should be conducted for all trafficked victims referred to a medical officer for a medical report, whether or not the investigative agency has specifically requested for it or not. Never rely on a single method for age determination. A combination of methods just discussed should be used. The medical legal report should be submitted to the investigative officer within 48 to 72 hours of conducting the examination. . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . .
Currently, there is no prescribed format for interviewing the victim or for writing the medico-legal report. It is advisable to follow a prescribed standard format. We are in the process of mounting an IMA website that will provide a prototype, the standard format for legal consent, for medical interview and medico-legal report online. In collaboration with Department of Women and Child Development and UNICEF, IMA has developed a manual for medical officers dealing with the child victims of trafficking and for commercial sexual exploitation and child abuse. This document provides guidelines for the medical officer to discharge their statutory responsibility of medical examination and age determination. This manual too shall be accessible online. The standard toolkit presented in the film is a very low-cost tool. The details of this kit shall also be available on the IMA website. Medical officers and hospitals can adapt this kit to their own needs.
We now provide you with a brief summary of all the steps involved in conducting a thorough medical examination. Step 1. Obtain victim's consent. Step 2. Obtain the victim's history and record all the information on the physician's examination sheets. Step 3. Obtain the victim's underclothing and place them in the appropriate bag and label. Step 4. Perform complete body surface examination and collect any foreign material. Perform fingernail scrapings if indicated. Request photographs if indicated. Sketch findings on the examination sheet. Step 5. Collect secreted test swab from victim's breast if oral contact occurred. Step 6, 7, 8. Collect, comb, clip matted hair samples with the enclosed scissors. Step 9. Perform a pelvic examination using a speculum and collect wet slides and swabs. Step 10. Collect cultures. Step 11. Collect washings of the vagina. Step 12, 13. Perform oral and anal examinations as indicated by the victim's history and collect wet slides, swabs and cultures. Step 14. Collect samples of the victim's blood for forensic and clinical testing. Perform additional forensic techniques as indicated, such as colposcopy, toluidine blue staining, Wood's lamp examination, bite mark impressions. Examine the wet mounts for spermatozoa, pack, label, and sign the evidence envelopes and place them in the kit. Seal the kit with tamper prevention tape to be forwarded to the forensic lab. Dispense prophylactic medications if indicated and desired.
My colleagues here have just presented to you the standardized methodology of medical examination, evidence collection, and age determination of sexually abused victim. Let me recapture the premises we started with. First, the conviction rate must be raised to prevent sexual crimes. Second, for conviction, high standard of proof is required by the criminal justice system. At this point, prevention of sexual crimes is very, very high on the national agenda. Rape crisis centers are in the process of being set up throughout the country. As the governments set up these dedicated centers for the victims of sexual abuse, more and more doctors must equip themselves with expertise in forensic examination. We of the medical fraternity must ensure that no perpetrators of the crime go scot-free just because of lack of training of doctors and because of the badly conducted medical examination.